about 6 years old. It was the day my baby sister was finally going to be born. After 9 months of waiting, the day was finally here. I wasn't allowed to be in the room when it happened. My siblings and I were children, and the doctor didn't want us all in the room just being a distraction. 5 kids can be a handful, even to someone who delivers babies all day. When it finally happened, there was no noise. No distinctive newborn baby cry. There was nothing, just silence. I was young, but I was old enough to understand that it wasn't a good sign. All babies cried, but not her. It wasn't until I was older that I really understood what had happened. But at 6, I knew she was dead, that my baby sister had never made it out of the womb alive. I'd like to take the time to speak to you a little about the reason for her death and why it was such a tragic loss that could have been prevented. There is no safe amount of alcohol to drink while women are pregnant, just like there is no safe time to drink alcohol during your pregnancy. Women often say when they're pregnant that they're eating for 2. The same goes for your alcohol consumption. Not only are you eating for 2, but you're drinking for 2 also. Dale King wrote in an article in 2006 titled Alcohol Consumption During Pregnancy. This article was published in the International Journal of Childbirth Education and states, when a pregnant woman drinks alcohol, so does her unborn baby. Alcohol in the mother's blood passes through the placenta to the baby from the umbilical cord. Drinking alcohol during pregnancy can cause miscarriage, stillbirth, and a range of lifelong disorders known as fetal alcohol spectrum disorders, or FASD. There are many negative factors that come from drinking alcohol while pregnant. Children with FASD can have distorted facial features, growth problems, and many central nervous system disorders, which can include seizures for the rest of their lives. It doesn't matter how much alcohol you drink or when you do choose to consume alcohol, because there's always a risk of your child having any number of defects that come with FASD. An article appeared recently in the online journal Alcohol Research and Health, titled Prenatal Alcohol Exposure and Miscarriage, Stillbirth, Preterm Delivery, and Sudden Infant Death Syndrome. In this 2011 article, Beth Bailey and Robert Sokol state, a study of more than 600,000 human births found a statistically significant 40% increase in the likelihood of stillbirth for women who consumed any amount of alcohol compared with those who did not consume any alcohol at all. Even one drink can lead to an increase of the chance that your child may never be born. It is easy to forget that what you do to your body, even in the first few weeks of pregnancy, determines the fate of your unborn child for the rest of its life. Is it really fair for you to make that choice for them, to choose whether or not they have a normal childhood solely based on what you decide to put in your body? It's a simple question, but there's no right answer. There's no handbook on what choices you should make as a mother. No laws telling you what you should do for the safety of your unborn child. But as a mother, you want to do the best things for your child. According to King, there is no safe time to drink alcohol during pregnancy. Drinking alcohol in the first 3 months of pregnancy can cause the baby to have abnormal facial features. Growth and central nervous system problems can occur from drinking alcohol anytime during pregnancy. The baby's brain is developing throughout pregnancy and can be damaged at any time. Every mother wants a normal child. No one wishes that her baby is going to suffer from FASD. Imagine for a second that you are or you want to be pregnant, that you desperately want the child growing inside you. But you have an alcoholic drink in your hand. Who knows how many you've had before that? Could you live with yourself knowing that that drink in your hand could mean life or death for your unborn child? According to Russell Kirby, who wrote in the Journal of Alcohol, an article entitled Alcohol Consumption During Pregnancy and the Risk of Early Stillbirth Among Singletons, the risk of early stillbirth was 80% higher among drinking mothers compared with abstainers, whereas the risk of late-term stillbirth was 40% higher among drinking mothers. As a mother, you want your child to grow up normal and happy and safe. But by drinking alcohol, you're taking all of that away from them. You're robbing your child of whatever chance at a future they may have, whether your child lives through your alcohol consumption or not. You may now ask yourself, how can my child ever have a normal life after that drink I just had? Another simple question, but like the one before it, not so simple to answer. There's a great range of alcohol defects that come with FAD. That one drink can cause any number of side effects, from a simple learning disorder to major facial dysmorphia and severe central nervous system disorders. There's no way of telling what your child could have until it's actually born, if it's born. The American Journal of Psychiatry, an article entitled Mental Illness in Adults with Fetal Alcohol Syndrome or Fetal Alcohol Effects was written. In this article, Chris Famey and Alan Unis state that they did a study on mental illness in adults that suffer from FAS. There were 25 participants in this study. The findings state, of the 25 subjects evaluated, 15 of the subjects met criteria for current or past alcohol or drug dependence. The second most common disorder 11 subjects experienced was depression. 10 subjects reported psychotic symptoms. One was diagnosed with schizoaffective disorder and one with delusional disorder. Bipolar I and anxiety disorders were diagnosed in 5 of the subjects, which included 4 with post-traumatic stress disorder, 2 with panic disorder, 1 with a generalized anxiety disorder, and 1 who suffered from claustrophobia. 18 of the 25 subjects received some form of hospitalization in a psychiatric institution. As you can see, consuming alcohol while pregnant can lead to severe lifelong consequences for your child. There's no safe amount of alcohol to drink when you're pregnant. Consuming alcohol while pregnant can lead to severe consequences for your unborn child, who has no say in what you do to them. You can prevent these consequences from ever happening if you just abstain from alcohol while you carry your unborn child. Remember that anything you put into your body also gets put into your baby's body. As King stated, when a pregnant woman drinks alcohol, so does her unborn baby. Alcohol in a mother's blood passes through the placenta to the baby through the umbilical cord. I was probably around 13 when my dad probably took the time to really sit down and explain what happened to my sister. You see, after my older sister Elise was born, my mother didn't care anymore. My mother would smoke and drink during her 5 pregnancies after that one, but she went too far with the last one. She had given up the nasty habit of smoking at that point, but she still needed that glass of wine or that one beer. My baby sister paid the price for her drinking habits. And now, instead of lighting her birthday candles tomorrow because she would be 16, we just remember how we had to buy that tiny baby casket. And hold a funeral for someone we never got to know, someone whose tombstone still doesn't have a name.